Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, question analysis sessions, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I'll always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 32-year-old female presents with fatigue, pallor, and shortness of breath. Her lab results show a hemoglobin of 10, MCB is 75, MCHC is 29, her ferritin is 10, and her serum iron is 30. What is the most likely diagnosis? Is it A, thalassemia, B, iron deficiency anemia, C, anemia of chronic disease, or D, vitamin B12 deficiency anemia? Take a moment and tell me what you got in the comments. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis? And I always tell y'all, if they're asking you for the diagnosis, you need to run it back and look at those assessment findings. You got to know, how are they presenting? What are the chief complaints? What's going on? What have you identified on exam? So that you can come up with a diagnosis, right? So this is a 32-year-old female. She is fatigued. She's pale, short of breath. Her labs show a low hemoglobin. So, we're already thinking anemia, but now we need to determine what type of anemia. So now, I always tell y'all to look at the MCB as well as MCHC with your initial identification of the anemia types. If you struggle with anemias, go check out my 212 rule on my videos. To help you tie those five main anemias together. But the MCB is 75, which is low because a normal MCB is anywhere from 80 to 100. So when it's low, that's considered microcytic. And then the MCHC is also low because the normal range is anywhere from 31 to 37. So this is considered hypochromic, right? And so there's two things that fall in the microcytic hypochromic range, and that's your iron deficiency anemia and your thalassemia, right? So you can narrow this down to A and B. But then if you look at this ferritin and iron levels, they're both low. So this will confirm a diagnosis of B, iron deficiency anemia. All right, question number two. A 28-year-old female with a history of heavy menstrual cycles presents with fatigue and pallor. Lab findings reveal hemoglobin of 9.5, MCV 70, MCHC 30, and a ferritin of 8. Which of the following is the most distinguishing feature between iron deficiency anemia and thalassemia in this case? Is it a low MCV and MCHC are more indicative of IDA? B, thalassemia is characterized by a normal ferritin level, while iron deficiency anemia has low ferritin. C, thalassemia typically has elevated serum iron and total iron binding capacity. Or D, the presence of low hemoglobin is more commonly seen in IDA. Tell me what you think. All right, so stem of the question here states, which of the following is the most distinguishing feature between iron deficiency anemia and thalassemia in this case? And y'all know, I always tell y'all this with the 202 rule, but anything we study, I always say, look at the things that present similarly, and then you have to determine how you differentiate between the two. So again, iron deficiency anemia and thalassemia both present with the microcytic hypochromic, right, on the lab. So the MCB being low as well as the MCHC being low. When you get to that point, you need to know one versus the other. But ferritin is your iron stores, right? And then your iron levels. They're both going to be low with iron deficiency anemia because we are deficient in iron. So our iron stores would be low. Our iron would be low, right? Whereas with thalassemia, they'll be normal. So B is your best answer. And for example, that's what the determination was in question number one. Remember, because in question one, if you look at it, let's go back. The MCB was low, the MCHC was low, our microcytic, hypochromic, but our ferritin and iron was low. That's why it was iron deficiency anemia. So again, B is your best answer. Thalassemia is characterized by a normal ferritin level, while iron deficiency anemia has a low ferritin level. All right. Last but not least, question number three. A 55-year-old male presents with fatigue, pallor, and numbness in his fingers. He has a history of a vegetarian diet and GI issues. Lab results show a hemoglobin of 8.5, MCV is 110, MCHC is 32, vitamin B12 levels is 100, and the folate level is normal. Which of the following is the most likely cause of his symptoms and lab findings? Is it A, iron deficiency anemia? B, folate deficiency, C, vitamin B12 deficiency, or is it D, anemia of chronic disease? Take a moment to tell what you got. So the stem here states which of the following is the most likely cause of his symptoms and lab findings. So, okay, this is a 55-year-old male, fatigue, pale, numbness in his fingers, vegetarian diet, GI issue, hemoglobin is low, the MCB is high, so it's macrocytic. MCHC is 32, which is in the normal range because it's between the 31 and 37. So we have macrocytic normochromic. And the two things that go into that category would be your folate as well as vitamin B12 deficiency anemia. So then you have to determine between the two. Your vitamin B12 is low, but your folate is normal. So that lets you know right there that we're deficient in vitamin B12, right? So C is your best answer. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864, or you can shoot a text message to this number, or shoot us an email to thenursingstudio, the number one, at gmail.com. All of the things that I do offer are linked in the bio of this channel. And if you're looking to book any of the one-on-one or customized sessions, I always say either call, text, or email, as I prefer to speak with you guys to make sure that you are booking the appropriate session type for what you need. All right, you guys, y'all know what to do. Make sure y'all meet me back here. Bye, y'all.